The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everybody. This is Harvey Rosenthal from NYAPRS, and I'm so glad you're joining us today. This is our effort to really make a contribution at a time when we're all dealing with such change, such stress, such uncertainty. And, you know, we signed on to provide service to people, and we're challenged on how to do that. And we're also challenged how to maintain our own health and wellness while we're trying to help others. And of course, we have to be healthy if we're going to help others. This presentation will feature Ruth Cologne-Wagner, who you'll hear in a minute, and Kristen Woodlock, and myself, and then Edie Schwartz. And we'll basically provide you with 3 different PowerPoint presentations. But we're going to start out with a new feature, if we can change the slide. A new feature that NYAPRS is rolling out today. And it really picks up the fact that about self-care. Ruth has been doing a great job for us in conducting mindfulness exercises, and this is part of us really recognizing the importance of self-care and just really being able to focus on the presentation in a grounded way. So Ruth, would you lead us through?
Thank you so much, Harvey. You know, we always talk about taking care of ourselves at NYAPRS, and this is just a wonderful idea that NYAPRS thought of helping to make sure that everyone that we work with, all of you, all of the providers, and in essence, the extension of our community, the people receiving services, and of course, everyone else who is living through these unusual times, for us to put a hand out there to ensure that you're starting your day off mindfully. And so what is Start Your Workday Mindfully, a daily NYAPRS 15-minute retreat? Well, it's our intentional effort to support you as you begin your workday. And we strongly believe that mindfulness will support you, it will strengthen you, it will center you every single morning. And we're here to help you achieve that. And I want you to know that this is the kickoff, but we will begin every single work week with you at 8 a.m. beginning on Monday. And you can find us on the NYAPRS website, www.nyaprs.org. We also want you to use the hashtag mindfullynyaprs so that you could help spread the word so that all other providers and people in the community and other helpers, whatever profession you're in, can also start their workday mindfully. So why don't we do this? Let's begin and have a little taste of what it is that we're going to be doing every morning. First, I want you to be comfortable, and you're probably sitting down. So find your most comfortable spot in your chair. Move your ankle and your arms, even your tush. Place your feet on the floor, and let's begin. And if you feel comfortable doing so, please close your eyes with me. The first thing I want you to do as you close your eyes is to notice your breath. Become more intentional with your breathing in and out. I leave the pace and the depth of your breathing up to you, so long as you keep breathing in and out with intention. So as you continue to do this, let's move our attention to our feet. Your feet may be confined in shoes and slippers, or perhaps you're at home without your shoes and you're gently caressing the carpet with your toes. Either way, enjoy the sensations you are feeling. Now please take another conscious breath and keep breathing. You notice your feet flat on the floor and notice the connection and how you're grounded to this earth through your feet. As we continue breathing, move up your awareness, up your legs and to the back of your thighs and your buttocks as you sit back in your chair. Feel the surface between the chair, your clothes, and your skin. At this moment, as you continue to breathe at your own pace, notice your back and how it touches your chair. With the same attention, notice your clothes and skin and where they make contact. Before we continue, keeping your eyes gently closed and body comfortable, let's remember how your body touches your chair, and I want you to sink deeper into your chair. Your buttocks gets heavier and your thighs sink and get more relaxed. Your back presses against and sinks into the back of your chair. You are becoming one with your chair. It is supporting you, caressing you, and helping you to fully relax. Enjoy this moment. Again, breathe. We're going to move up now to your shoulders and neck and head. Please slowly turn your chin up and lower your head towards your back. And as you do this, press your shoulders down away from your extended neck. Breathe. Let your entire body, including your head and shoulders, sink back into your chair. You feel the weight of gravity pulling you down into your chair as your body enjoys a release of tension, that tension to go somewhere else in the universe, away from us. For us, we claim our breath and we claim our calm state. When you are ready, lift your head forward towards the front of your chest, down towards your chest, and enjoy the lengthening sensation in your neck. Make sure to keep breathing intentionally. Now, when you are ready, lift up your head and slowly open your eyes. You're now ready to begin learning, leaving all other work behind, and to pay all of your attention with purpose to Harvey and Kristen and Edie. So remember that you have the power in you to recall the sensations that you experienced this morning at any time you need it, whenever you feel you need some stress and relief and a mindful moment. And I hope to see you on Monday. Please join me at 8 a.m. Thank you, and now I'm going to pass this on to Kristen.
Thank you so much, Ruth. I really appreciate that. That was absolutely fantastic. So hi, everyone. This is Kristen Woodlock. I want to try to share with you some tips for remote working, and I call these tips for staying effective, brave, awkward, and kind. And the awkward part is in there because we all are learning something new as we start to embark on more and more remote working. So the first thing that you want to do when you're remote working is try to create a space for your work. And what you see on the screen right now is really not the most ideal space, right? So we want to try to find a space that has a low amount of noise, right? And particularly if you're sharing a small space with somebody else, that could be a challenge. So you may have to try to talk about how you're going to schedule your remote work. You want to find a place that has good mechanics so that you're taking care of your back and your neck and your shoulders and eye strain. You want to also try to think about having a door and a room with a door if at all you possibly can. I think we all remember some of the viral videos, and those of us who have been doing remote work over the last few days or weeks have gotten to know people's children, dogs, significant others. Sometimes those can be really funny. But other times they're not so opportune, and so try to get that door so that you can signal to people who are sharing your space that you need some privacy for the time that you're going to be doing some remote work with other folks. Next, you want to try to keep your work routine. So if your normal work routine was 8:30 to 4:30 or 4:30 to 2 a.m., whatever that time is, try to maintain that routine. That will give you a really good grounding, and that's important. If you have to do a different kind of hours because of the expanded work that all of us are trying to do right now, that's okay. But remember to try to set boundaries from when you're doing work and you're not doing work so that you have time to relax. You have time to walk away from your work, even though you may be working in a small apartment or a small home. And in case you need a reminder for that, you might want to ask somebody to call you at the end of the day, just so that that's a way of sort of closing out your work time. You might want to set your alarm on your cell phone so that that can remind you, okay, I said I was going to work till 4:30, my alarm just went off. Now I'm going to switch into my personal time and relaxing best as I can. Next, make sure you also schedule stretch breaks and walk around a bit. I think this is one of these things that we learn as we're starting to work remotely, just how much we walk around during the day and we don't even think about it. Somebody comes into our office, they say, can you walk down the hall here with me and give me your advice on this? You go out to get a cup of coffee with somebody. We move around to meetings. And when you're working remotely at home, you again need to remind yourself to stretch and walk around a bit. Some strategies of how you can do this: you can decide maybe every other video conference, I'm going to take that standing instead of sitting. Or I'm going to do some stretching in between meetings. I'm going to walk around my room, my apartment, my house. If you can, if you're in a place where you can get outside, even if it's to sit on a bench or to take a short walk, just remember to take care of yourself. And again, Post-it notes, alarms on your cell phone, those are things that you can do to help you remember to get out and stretch. So remote work is different. And I think at first when people, are learning that they can work remote, they think, this is fantastic. I've won the lottery. No longer am I going to have people interrupting me. Oh, this is going to be perfect. I can do all my work and not be interrupted, which may be true to a point, but it can also be really isolating. The amount of interaction, as much as you might think it was something that was kind of annoying or kept you from being as productive as you could, it's also a way that we're connecting with people, and particularly people who are helpers, people who are trying to help other people, have taken these jobs because they like to interact with other people and they like to see that personal support and connection. So you might want to think about some different ways that you're going to be able to get that connection with people. So maybe you set up team meetings every morning or every afternoon to check in with people. If you want that more on a personal level, maybe you decide to have a group of your coworkers or colleagues that you have coffee with every morning, and you do it on the phone, or you do it with a Zoom or a webinar connection so that you can see each other. Those things are very important. And also another thing that I've heard actually just today that really struck me was, if you are somebody who is doing advocacy, peer support, care management, even telehealth or telemental health services or telesubstance use services, remember that it might feel unusual or uncomfortable if you're doing what you do via a video connection or a phone connection with somebody, but that connection is still you being a compassionate person who's connecting to help them. And just remember that connection is going to come in other ways, and talk with others about sort of tips and strategies you have to make that meaningful for you and meaningful for the people that you work with. All right, I'm trying with technology to get my slide to move. There we go. And this is very tiny, so I will talk you through this. So I always like to have people tell me, okay, that's great, you've given me a concept or idea, but like, how do I do that? What do I need to do? How can I know if I'm doing this well? How can I help my team be better at this? And I absolutely love the work by Dr. Brené Brown. If you haven't seen that, she's got a fabulous amount of stuff and resources on the internet. I love this braving. So braving is an acronym for several things that we can talk through. I'll talk you through this quickly. But these are things that we can do to say, how am I doing? What do I need to work on? What will being a good teammate look like during this remote time period? So let's jump in and I'll take you through these. The first one is B, boundaries, that you respect my boundaries, and when you're not clear about what's okay and not okay, you're willing to ask. So how might this look in remote work? If I'm following the guidelines that we've just talked about, and I'm going to work from 8:30 to 4:30, and one of my colleagues says, I'd like you to be on a webinar every day from 7 p.m. to 9 p.m., I'm going to have to talk to them about, can we talk this through? That's outside of the time that I have. Let me tell you why that's an issue, and let's try to figure out some other way that we can meet the need that we both think is important, right? So it's just being explicit about those conversations about what's okay and what's not okay. And that's going to be particularly important with all of the increasing demands and other things that we're working on. We have to make sure that we're able to talk those through with our colleagues. Next is R, which is reliability. So you do what you say you're gonna do, you stay aware of what your competencies and your limitations, and you don't overpromise. So what might this look like for us in remote work? So if I've never been on a webinar before, never done anything by video before, and I say to Harvey or somebody else, I say, I'll do that video for you in 15 minutes. It's going to be great. And Harvey says, but we have 4,000 people on that. I might not be the person to do that. And that's not because I don't want to, but maybe I don't have the skills to be able to do that, and I'm over-promising what I'm able to do. So we want to make sure that we're thinking about what we can do and can't do. And those are also opportunities for us to get some of the training and support that we might need. So if that scenario happened, you may try to get some supports to use video so that you feel like you're able to do that. A is for accountability. You own your mistakes, apologize, and sort of clean up something that goes wrong. And I think it's also important for us to know that all of us are new, for the most part, at remote working, and we're all trying to learn how to make this work. We are going to make some mistakes. Something might not come as planned. So when that happens, just make sure you own that for your team and you talk about how you can fix that going forward. I is for integrity. So you choose courage over comfort. You choose what's right over what's fun, fast, and easy. So for this one, you want to make sure that you are really the best ambassador to your values during this remote work, and that you have, the same level of attention. So, if I'm on a webinar or video with you, I'm not like looking out the window and waving to my friends and, putting you on mute or not putting you on mute and, talking all with my hands. I'm really giving you the same level of attention and commitment that I would if we were sitting across from each other and having a meeting. N is for non-judgment, that we can all ask for what we need and be able to have that conversation and not be what I would say is super judgy. So if you have a colleague who is new to remote working and you've set up 3 meetings with them and they don't show up on the phone or they don't show up on the video on time, rather than saying, well, Kristen is a real jerk, I can't believe she didn't do that, we want to try to reach out and think, okay, what is it that's going on here? That's not like Kristen. How can we have a conversation about how we can fix that? And the last is G, which is generosity. You extend the most generous, interpretation possible to the intentions, words, and actions of others. So when all of us have so many things that we're trying to keep track of, loved ones, friends, our own changes in our routines, that we just make sure that we're interacting with each other with true generosity and trying to figure out how we can help. And again, these are great tools for us to use for ourselves and also for our teams. Next, just a quick run through of some video and webinar etiquette. These are things that you may never had to think about before. So these are some tried and true things for you to be a superstar in doing your video and webinars. First one is to make sure you introduce everyone at the beginning. You want to make sure you know who is on the video and webinar. You also want to try to build a community around that, so we know who's on, where they're from. We know voices if we're just doing voice, and we know faces if we're on a video webinar. That's also a great time to be able to talk to people about how you're going to do some basics, sort of what are our agreements? Are we going to raise our hand if we have something to say? Are we going to put ourselves on mute? Whatever your sort of culture is going to be for that meeting, it's a great opportunity to do that. Next, you want to make sure that you have, a clean, work-appropriate background, that you don't have necessarily your messy dining room table with all your takeout food or, your art projects that are behind you, and that you've taken the time to look at your video background ahead of time and say, is this something that is, not distracting, and is it something that I want to share with the world and show the world? Next, you want to look into the camera and not look at yourself on your video screen when you see that. And that is really hard to do. I think it might be harder than the advice that we're getting about not touching your face. But just remind yourself and try to get into the habit of looking at the camera, because that really does create a connection with the people that you're talking with, and also shows that you're with us and you're paying attention, which is great. Next, eliminate distractions and focus on the agenda. So again, think about this from that same perspective of making sure that you don't have TV, noises, other things that are going on in the background. other people's phones ringing, or other people potentially making noises that are going to affect the meeting that you have. And stay with the agenda and think about that you are sitting at a table with those other people, and how would you conduct yourself? And that's really what you want to do on your video webinar. Be aware of your audio and video settings. I don't mean this from a techie perspective, but just remember that, you know, if you do like stop paying attention or have to address something, that you don't have yourself on audio and video, so that everybody gets to hear whatever's happening in your background and everybody gets to see what's happening in your background. You know, I'm sure there will be lots of interesting stories of things that are heard or seen on videos, and you probably don't want to be one of them. So just make sure you're always aware of your mute settings, how you set up your meetings and your video. Only invite the meeting participants who need to be there. You don't need to necessarily have everybody in the organization on every meeting just because we're remote working and we think it's cool, right? You need to think about who needs to be there. Let's keep our meetings efficient. Let's keep them focused, and let's keep them at a level where we can get to the result that we want. And lastly, if you're the host, make sure you stick around for the meeting. Sometimes if you're the host and you leave the meeting, the whole meeting goes offline. Also, we want to make sure that we have somebody who's consistent in the meeting, who can handle administrative issues, technical issues that might come up, and somebody who can make sure that the meeting stays on track. We have our introduction, we have our work we're doing, we have our closeout and our follow-up. So that's just an important administrative function for our video and webinars. So with that, I will transition to our next segment. I thank all of you who are doing remote work and doing it bravely. All right, so our next piece, one of the things that NYAPRS was just a really brave leader on, and is partnering with the Coalition for Behavioral Health, and both of those groups asked if I would join and help with some content. We really wanted to do something that helps us feel connected, and something that helps us really with the broader universe, right? This is not just within a mental health, substance use, healthcare field. We said just connection is so important, and we want to be good ambassadors for that. So we came up with the Strive for 5 challenge, which is New Yorkers looking out for New Yorkers. And one of the things that's very interesting to this is that, and I'll go through this in a second, but we've already heard from the state of Ohio, who wants to bring the Strive for 5 challenge to Ohio. And just this morning, I was contacted by somebody from Scotland who is really excited about this. So if you think that connection can't make a difference, boy, I'll tell you, it can really make a difference. So let's figure out what this is. So we know that social connection is part of being healthy. But we also know, because we're on a video, that social connection is going to look different for a bit. So we're going to have to think about social connection differently. So the challenge, which we know you are so up to, is to identify 5 people to check in with every day for the next 5 days. And if you already are checking in with, 100 people, however many you are, that is absolutely fabulous. We want you to find people to take this challenge who can find 5 more people, because then it just grows and grows and grows. And as we think about this, we want to try to prioritize people who perhaps are living alone, who are in recovery, who might be feeling more isolated or anxious, and just don't have that person to lean on, or haven't reached out in a way. So those are the folks we want you to look at for your challenge. So you don't have to be a perfect friend. And I loved this graphic from Snoopy. And a perfect friend is somebody who is always happy to see you, is full of great advice, always ready to listen, available to lean on, who's good for holding space and helping when you need that, is good for standing by your side, has a warm spot in their heart for you, and loves to share a smile. So you don't have to do all of those things, even though I know most of you have all of those traits. The key thing is that you just reach out, and you're offering an opportunity for somebody to be connected. So if you're thinking about the Strive for 5 challenge, or talking to others about it, or putting it on your social media, we want you to have people think about starting a team and a challenge. This is a way for team building in your organization or company or club or family. To say, let's all challenge each other to take this on. And we want you, if you're going to take the challenge, to email us with your start date. We are trying to, keep track of our ripple in the universe and how we're keeping people connected. So we've set up a separate email account at strive45challenge, all one word, @gmail.com. And we've gotten emails already saying, I'm in, and this is where Ohio came from and Scotland came from. So it's just great to see the momentum on this. And also use your social media to promote more and more people committing to connect with 5 people a day with the hashtag NYStrive and the number 5. So just as we start to do this, sometimes people can say, well, I don't know what to say. So empathy and the keys of empathy are really fabulous things to have in the back of your mind. So as you're reaching out to somebody, we want to say, I'm in it with you. We are all experiencing this. You're not alone. We're here. But that also I'm not here to fix you, and I'm not here to feel it for you, but I am here to feel it with you and let you know that you're not alone. So that might be something if you're going to take the challenge, or you have somebody who's not sure how to handle the challenge, give them these pieces around empathy, give them the Snoopy perfect friend, and those can be things that help guide them. So I think we covered this. So this is, and this is just a spark created by the Coalition for Behavioral Health and NYAPRS, and we are already seeing it again go through the universe, but we encourage you to get others to join in as well. And with that, I will turn it back. To our NYAPRS team. I'm not able to move the slide, so maybe you can take that over for me. There we go. Harvey, it's you.
Hi, everybody. Can you hear me now? Assuming you can, or someone would be texting me.
Yes, we can hear you, Harvey.
Okay, thank you. Well, Kristen shares and Ruth are really wise women of heart, creativity, and dedication. Have a lot of the things you heard in the braving, integrity and generosity. And Kristen has humility because the Thrive for 5 campaign really came from her. In fact, the first spark towards this whole presentation came from me reaching out to her about the first presentation you heard. So she's really ahead of the curve. She's very generous. Ruth is, again, the same, and she provides such great sort of grounding. So I want to thank them both. I also want to remind people that there's apparently a box where you can start to put your questions in, and then Edie will work that out. We'll use that to organize the last 10 minutes. So I can't move my slides, so Eileen is going to do that. And again, what you'll see here on the cover is we're really looking here at strategies to serve individuals remotely and in the community during this crisis. And very shortly after this, it'll be downloadably available on the website. And I think Eileen will be sending out copies of the PowerPoint to everybody who signed up as well. Next slide, please. So if you don't know who NYAPRS is, NYAPRS has been around since 1981. And certainly since 1995, we've organized and been a real force to be a change agent who brings together people in recovery, who provide or receive services as a very powerful sort of change agent. And through any number of strategies, through advocacy, through some training and TA, and the creation of the Peer Bridger model some years ago, and demonstrating innovations, we've been really trying to improve services and public policies and social conditions, people with mental health, substance use, and trauma challenges. And our focus, of course, is health, wellness, and recovery, full inclusion, and to help support people to and believe that people can achieve maximum potential in the communities that they choose. Next slide. So I want to thank everybody who responded so quickly when I asked for some ideas and some steps that they were taking to adapt and extend their services during this time. primarily in a remote way, but a number of people are still doing face-to-face. And the response, the creativity, the dedication, and the courage that you'll be hearing in the way people have adapted and maintained that front and center, person-centered dedication. That's all about recovery and rehabilitation and rights and dignity. And I suspect that many of the things that we're creating now will survive the crisis and will help transform our service system, another level. Next slide, please. So I'm going to go through a lot of feedback that I got from various program models, mainly in New York State, from particular providers. So the clubhouse model is very dependent on an interconnected community. Each day starts with a morning meeting. There are work units throughout the day. There are any number of outreach and engagement sort of strategies. How does that get maintained? So the clubhouses in New York, Venture House, Fountain House, and the other members of the Clubhouse Coalition have formed a virtual clubhouse where the members can stay engaged through private Facebook messaging. They actually hold a community meeting across these clubhouses on Facebook, and people can attend the meetings through Zoom and Slack, and all staff are available live through a call forwarding system. So they're really trying to, as you'll hear again and again, people are trying to keep the best parts of the program, the best connections, even often during the hours that they normally would be offered, to try to make this as less jarring and chaotic and unreliable, uncertain. The staff are conducting daily outreach calls. You'll hear that throughout this presentation. And they often make assessments with the person around if they need more or something different and act accordingly. What they've done there is to mail out to all the members and regularly update on Facebook and the website. So there's an intensive, constant way to keep the connection and throughout the day. Next slide, please. So this is a housing options made easy in Western New York. I really was touched by their phrase, no one who is in a crisis is alone. They really, as all these groups do, want to make sure that they recognize crisis and they're available. So housing options is a combination of virtual and face-to-face. They're providing daily check-ins via the phone, video conferencing, and text. Text is a big thing that people are using. You would expect phone and video conferencing, but texting. They operate all their crisis intervention services are still available, whether they're on the phone or in person. And in fact, they operate crisis respite and crisis diversion, so drop-in services that are face-to-face and are fully operational. So there's a range of face-to-face and virtual, but they're really trying to make sure that no one who's in a crisis is alone. Next slide. So here's an agency, Baltic Street AEH in New York City, that really has created a comprehensive mobile peer support network. They use Zoom group conferences, FaceTime calls, Facebook messaging, use of social media. I see some of their messaging on Twitter. They still maintain their warm line services and direct phone contact. They also have a nationally recognized resource and wellness that continues to provide a range of supports on a virtual basis and addressing ways that people, in terms of hunger, in terms of how to help people with the self-distancing, and to provide a sense of ongoing inspiration and hope. And they're still operating groups that are very appropriate during this time. As you can see, managing anxiety during difficult times, feeding our mental health, immune-boosting foods and tools, poetry that inspires us during hard times, and a conversation on self-distancing. I know that's really hard for me. My partner works in a nursing home, and I'm 70, and I have issues related to my lungs. So we really, we struggle with that. She has to take a shower. We have to keep distance. It really makes this a hard time, and so it's helpful to get all the support we can here. Next slide. Restoration Society in Western New York really is focused on making, like we all know, that connections are key. So they've maintained a lot of strategies and added some new ones. They're calling every customer in every program on a daily basis. They're implementing 24/7 response team lines. They added a conference line just for the customers to use as a group line for formal, informal group support. They offer an enhanced 7 days a week, day and evening calendar, which includes classes, groups, chats, and art groups. They also, and this is true of a number of programs, they make deliveries. And they offer face-to-face and sort of contacts as well. They're continuing to run their homeless center, but they make extra precautions. And they run it during extra hours. But they do some pre-screening at the door, they maintain social distancing and regular sanitization. So, the work we do is all about relationship and trust and honesty and caring, and everybody here is trying so hard to make sure all those connections are operating, and whenever possible, expand the hours, continue to offer programs at the same hours they were, and to not close programs that are in the most needed. You'll hear about shelters, pantries, crisis drop-in. Those programs are operational. And the same with community residences, of course. Next slide. Here's a program in Florida that responded to the call, and they really use any number of approaches. They use their website and social media pages. They do tele-delivered peer support. They've reached out to every individual, including people they served in the past 2 years who may have wandered away or not as engaged, just to look in on them and maintain that commitment and use that familiarity. They sent a newsletter. There are a number of programs that are mailing, not just on the internet or electronically. So they sent newsletter to over 700 recipients with information about the peer support services. And there are a number of programs in the country that told me that they really need more money to operate in this environment with more hours and more services. So they're applying for disaster dollars to avoid having to shut down their warm line. And they're not the only ones. Next slide, please. This was really, this was very touching. There's a program in Western New York in the Buffalo area, Mental Health Peer Connection. And watch where there's everybody wants to talk, so we are just listening. How powerful is that? So they do a lot of listening and support, but they also do what a couple of programs do, which is given that people are out of work or don't have are not on site getting vocational and pre-vocational services, really try to maintain that. So Mental Health Peer Connection calls everyone they serve. There are 20, I think they have 1,000 people that they serve. And there are 23 staff, average 5 contacts a day. They have developed a secure and confidential way to hold 2 to 3 virtual groups a day. Back to the work, many have lost their job and their purpose and their I matter self-esteem. I have to confess to you that my work really defines me and I love my work. It's really hard to be isolated and to do everything on a virtual basis because the connection with people, colleagues, and the people I support, so important. So getting a job is what the folks who are currently out of work seek. So they're encouraging people to act as if they're still working, and they're pushing self-care and structure and and maintaining ADLs and a purpose to be ready to return to work. We don't want to see people backslide and lose all the work they did on structure and routines and commitment and self-care. So they're paying a lot of attention to that. Next slide. There's a program in Central New York called Turn the Page Again. It's run by Transitional Living Services or Access to Central New York. They have an affirmative business program, and they have sent links to online job leads to their members and are making sure the participants have updated their resumes. They're taking advantage of this time to keep the focus on jobs and work very active and alive. They're also working with anyone who would like assistance with online applications. So important to keep that going. They've also sent links for cognitive games. I'll talk about that a little bit. And again, for those people, there are a number of people, this is all based on technology, and I'll talk about that a little bit sort of later. But, some people struggle with that, and they pay extra attention. I'm going to speed up a little bit. Next slide, please. Associated Mental Health and Wellness is very focused on vets and face-to-face, as you'll see. So veterans continue to receive a lot of virtual services, but they keep open their pantries, their shelter. Lunch and dinner are delivered each day, and you can get a dry prepacked breakfast on site in the morning. So they're really, this is an example of a particular group. They do it for a lot of the group they serve. But I wanted you to see how, here's a group that's really, really getting a special sort of focus. Next slide. The MHA Westchester works with young adults in their On-Track First Episode program. So they pay a lot of attention. They have regularly scheduled appointments via telephone or video. They have, they make psychiatric assessments. They have a psychiatrist who's used to working with video. And in terms of team functioning, and there's a lot of that, we have to pay attention to the staff. So they hold regular meetings via conference call, a daily team check-in, and a weekly full team meeting. Those are so important to make sure the staff are connected, informed, supported, able to ask for help, etc. And they use shared documents in a secure SharePoint drive. Next slide. Mental Health Empowerment Project, peer and agency, Capital District, Hudson Valley. The unique thing they're doing here, they're doing a lot of what people are doing, peer support meetings and groups, but they're not only supporting members of the recovery community, but members of the general public. And that's so important. You hear in the newspaper that 6,000 mental health professionals volunteered to staff a mental health line for everybody in response to the governor's request. So inspiring that 6,000 people did that almost overnight. Well, Mental Empowerment Project is also really interested in reaching out to the general public. They are available 9 to 9 with telephonic support. They have a virtual, every day, a daily peer support meeting and an alternative to suicide prevention group. Next slide. Here's a group in Minnesota. Their focus, I thought this was interesting, is they focus not only on the staff but the board. So they keep those connections going. So the board and the staff really feel engaged and involved during this difficult time. And then everybody knows what everybody's doing. Next slide. There's a NAMI chapter in Saratoga that's been handing out, they created a document and they're handing it out. And they really are aware that people are going to have trouble getting out and getting their meds. So they're really focusing people on getting a 90-day supply versus a 60 or 30. Next slide. Access Supports for Living in the Hudson Valley just opened up this week a virtual mental health and substance use virtual urgent care resource. Therapists are available 24/7 with that and by phone and telemedicine, and people can get access around the clock to psychiatry and peer support for any person in the Hudson Valley who needs that help. Next slide. I want to speed up a little bit. ICL, the Institute for Community Living in New York City. This is an example where an agency really, the managers of the agency really took special care, as you'll see, to make sure people are connected, that things are happening in an accountable and reliable way, and that staff feel clear and supported and protected. So on the executive level, they created a policy-making team, meets every morning to set the agenda. They have daily end-of-the-day calls with the executive team. They have a daily morning call with the CEO and the senior vice presidents, and information is shared on a regular basis. They communicate with staff regularly, daily emails with staff, dissemination of Q&A, creation of guidelines, and educating them on isolation, mask policy, and telecommuting, and the use of an intranet within the agency to keep that communication going. Next slide. In terms of their maintaining staffing, they really want to make sure, of course, that all programs have at least one staff. And they're probably talking here about residential programs. They're looking for temps and backfills. They anticipate people will call in, there'll be attrition or shortages. They create a list of existing staff who could be transferred to a setting that really needs them, often on a moment's notice. And they encourage staff to use the city's enrichment centers for child care. They protect their staff. They really try to help many of them to work from home as possible. They create a workflow process at each facility to make sure people are screened and isolated if they have any evidence of COPD. And like so many of you, they clean the facilities all the time. Next slide. I just had to say this. This was one of the things that one of the programs had a death last week, and they think it was due to the virus. And he was a young man, not just an older person that we're hearing about. It impacted the group he lived with tremendously, and the peer specialists really worked to support people, and the staff that needed to support each other via video. God forbid you'll all have to face that, but you know the death rate is increasing. Fortunately, it may come to, it may reach all of us. Next slide. This I thought was really important because so much of we talked about is electronic, if you're going online, if you're taking phone calls, if you're texting. Well, what happens if the minutes run out? There's no good answer to that now, unless case management teams or ACT teams or peer projects have wraparound money where they can either buy cell phones or minutes. But this is a huge issue. We're hearing stories of a lot of people who don't want the phone calls or who don't want to stay on them for too long. I feel like I'm willing to call some of the phone companies and discuss it. Next slide. So this is quick. These are the online self-help groups, and they're 12-step for the most part. Everything on the first page is 12-step. You'll see, AA, NA, Debtors Anonymous, Codependents Anonymous, Sex and Love Addicts, Workaholics. Next slide. The Depression and Bipolar Alliance, they have groups as well. The Hearing Voices groups have have a phone line, and the International Association of Peer Supporters. All these are links. You're going to get these PowerPoints. You can click to those links. Next slide. Even more about that. The last four are interesting are Recovery International, which is the old Recovery Inc., whole other program. My daughter uses it, and it's very impressive and very effective. Next slide. This is something I learned about. Hey Peers is a third-generation platform from a group called Peer Support Solutions. I'm not advertising for them. I don't know if they charge. Perhaps they do. But I was impressed that they host over 250 peer support meetings a month on a variety of topics, and they reach people in over 130 countries. The fellow that does this has reached out to me. I'm going to find out more about it, and I'll do a post on that at some other time. Next slide. Online tools, YouTubes, you can watch them on exercise, meditation, yoga, cooking, you name it. Speakers, mock 12-step meetings, live, in video. Certainly all the social media. These are a bunch of apps. I didn't listen. I know some of them. I'm not advertising for them. We don't have a financial relationship with them. Some of them, like Calm and Headspace, I have used. They start to charge if you want to use the premium services, but there's still a whole lot of service there. And Replica is an artificial intelligence, so it's a person, in effect, who gets to know you and responds. That's free. There are free online yoga classes, and again, I haven't tried these all. I'm just suggesting these are some of the options. Next slide. Podcast, I'm not going to tell you a lot about them. I'm going to listen to Hilarious World of Depression. That works for me. There's one called The Nod that focuses on the experience of African Americans. There's one called Throwing Shade that focuses on issues dealing with women, minorities, and the LGBT community. Again, I haven't heard any of them. Just wanted you to know about that podcasts are available. Next slide. This is one, if you're really going to listen, I can't watch TV for too long. I watch too much of it now, and you know what I'm watching, and it's very damaging to my mental health. But this is a way to hear about it in 10 minutes a day through NPR. You can click on that and get that, and maybe hearing it in small pieces will be helpful. Next slide. Imagine this. There's a program called Discord where people are able to stream movies for other people to watch as well. Don't tell Netflix about that. Also, people are going to drive-in movies. I assume everybody in the car is not contagious, but it's pretty wild. Next slide. You'll know this. You're using your EAP service for the staff. There's a SAMHSA disaster stress line, and of course, National Suicide Prevention Lifeline. Next slide. OMH, this is that one with the 6,000 staff has volunteered to be available. This is the phone number, and the hotline is 8 to 10, 7 days a week. Next slide. So the staff were having some fun. You have to have some fun. So we were coming up what I call a social distancing soundtrack. My favorites are In My Room and Can't Touch This, right? That's pretty funny. I also, being a Ray Charles guy, you know, I really like all Lonely Avenue, but meant to be funny. I hope you take it that way. Next slide. This is my cat, Joe. Take him in. Many of us have pets or pet therapy. Joe knows how to sleep in a deep way. He's a role model for me about sleep, and he's a loving and open and innocent sort of creature. I don't know where I'd be without Joe. He gallops all around the house. He's a great support to me. I'm sure a lot of programs have pets, emotional support animals, etc. Really critical at a time like this. Next slide. And this is our email addresses. I'm going to turn it over to Edie because we have only about 8 minutes, unless some of you want to stay on for comments or questions. So I think I take
okay. Yes. I'm sorry. Can you hear me?
Yes.
Great. I am just trying to get my webcam on. There it is. We have a couple of questions, and I just want to remind everyone, if you have a question or a comment, I've been answering some comments along. Just go over to the question box and put it right in now, and I'll pull it up. So, Kristen, if you could come back and just go over what the V is in braving. It was a bit of a question, and with the slide gone, of course, I couldn't remember. And so,
Thank you. Thank you for that. And I'm sorry, I do that sometimes, even though I do braving. If I look away for 2 seconds, I'll go to the wrong one. So thank you all for being generous with your assumptions on me and coming back and saying, could you do that? That was a great example, not planned. So V is vault, and vault just means remember during times like this when we're working remote that our shared commitments to share what is ours to share and what is not ours to share need to stay in place. So not only do we not share, you know, information that's private for somebody, but we do that with our colleagues, and we really maintain that integrity. So that's V. Thank you.
Great. There's another really good question here, which is that someone wrote in that it's not their norm to stay on the phone for a long time. And I actually get this because, boy, you know, I'm born and bred in New York City. I love to talk, but I don't like to talk on the telephone. And so she asked, now that they're spending 12, 14 hours a day doing direct service on the phone, are there any tips that anybody has for being able to be more comfortable and being able to be on the telephone longer? Because that's kind of what we have to do now.
So it's really interesting, Edie, that you know, whatever time it is now, almost 1 o'clock, somebody's brought that question to me twice just today. So I think this is a new thing that we're figuring out, right? That it's sort of weird to be on the phone, and how do we do that? So that is something that I'm trying to work on with the next iteration of some content to say, you know, what is a little bit like, what are these calls made up of? How do we talk to each other, right? It sounds easy, but it's not when you're doing it consistently. So that's something that I'm going to certainly try to work on. And that's another great thing. Like, you know, Harvey went through so much great work that people are doing. So if anybody who's listening to this webinar, I'm going to volunteer you, Harvey, but if anybody has ideas of how to answer Edie's questions about how to do that, you know, you can share your ideas too, and we can make sure that we, you know, spread them around so everybody has the benefit of all of our thinking.
You know, I don't know if you can hear me. Can you hear me?
We can hear you, but your picture fell off the screen there.
All right, here I am, handsome as ever. But,
yeah.
you know, there's all the email addresses of everybody who sent it to me, so I can create a loop and ask questions. I asked them yesterday, how do you handle the cell minutes question, which is really huge. So yeah, I'm happy to do that. Any questions that the group sort of comes up with.
Yeah, here's a couple more questions. Again, we may not have the answers to this, so if you have an answer, chat it there in the question box. And again, we can put these around. I think all of you Len wanted me to remind you that there actually were 459 people on this, and we could only take 500. There were actually 501 folks today. So there's a lot of people with us with a lot of good ideas. So, so there's another.
There were like another 500 that couldn't get out. And as a matter of fact, we're going to move to a bigger platform because we're going to do a whole series of these. And we want all of you to be able to come.
Yeah, we're going to also post this. I think Eileen is recording it, and we certainly will put the slides up on our website, so it'll be available. So here's another question I want to get in before we close. Part of our services include jail peer services in Fulton and Montgomery counties in upstate New York. Internet access is prohibited in New York State correctional facilities where the inmates are receiving services. Any ideas on how we can engage in the correctional facilities? We are delivering recovery-oriented literature and worksheets at this time. So they're handing out papers, but I guess they want to have some human contact.
I know a little bit about
Any idea how to do that?
It's a big issue for me. I know a little bit about it. First of all, I'll say it's a little easier in the jails. I do notice that peers are working in the jails, but I know that one peer program is we're working on a state prison, Sing Sing prison, for some time. So somehow it's not across the board. I also know I've been part of a video and others, and that was years ago, where the correctional officers are being educated. I think the Office of Mental Health is working with docs to relax this, so it is still a major problem. But it's something that's understood, and a number of advocates like me and others are keeping a close eye on it. But it seems to me that it is happening, but certainly not the across-the-board policy. I promise, criminal justice is my top issue these days, to follow up on that.
You know, I'm gonna read you a couple of these things. There's great ideas coming through here for the question about being on the phone for too long and having trouble being on the phone for so long. People are saying use a headset. That sometimes helps. And another person, you see Kristen's headset, and another person said walk around the house. And with a headset and a cell phone, you can actually do that. And so people gave those two suggestions. Also, the issue about corrections, a lot of people said that they were having some similar problems. And one person is saying we drop off and pick up paperwork daily at their local jail. One of the things I would suggest, although I know rules and regulations in jails and prisons don't change so quickly, but I think we've never been in a situation like this before. And so I would give a call to someone in the jail and ask if there's anything that can be done. They might bend a rule. I don't.
We're actually heading in the wrong direction in that the virus is just spreading through the prisons and jails. And the answer, unfortunately, for too often is to put prisoners in solitary confinement, the torture of that. So they don't have this is a real process. It really is becoming an issue like any institution.
So one thing just to toss out there, Harvey, that again may or may not be possible, but just with some social distancing, for those of you who are working in, local jails or prisons, would the prison that you're working with, or would corrections or the county start thinking about some small groups that you could do where people again are separated, but potentially one of us could come in on a video feed, kind of like what we're doing right here, and do some kind of thing. So we, I think as Didi's saying, we have to get creative and think about ways to ask, because, don't assume that people have the answer of how to do this. So if you can think of something that's creative and yet respectful of the fact that obviously in a correctional facility, you have to maintain some kind of order. How do we find some way to be creative and, not have it be solitary confinement, as Harvey said? So just keep your thinking hats on and keep sharing those ideas.
I'll shoot some emails, at least with OMH and maybe docs, and follow up on that.
Yeah, another person had this wonderful, wonderful idea, and that may be the last one we can share today, which is while I'm on the phone with the people I'm talking to, I look outside my window and I ask that person to do the same and to share what they're looking at and I share what I'm looking at so that we can feel like we're looking at something together. And I think that really kind of speaks to what Kristen just said. We need to be creative, and who is more creative than our behavioral health system? Nobody. So I think that is great. Another person tries to visualize the family from our last face-to-face, which helps me connect with them. So again, keep your ideas coming. I want to just remind folks what Harvey had said about there were 500 people who could not get on today, and we are going to have more of these. NYAPRS is committed to we know some of you may have wanted to come to our executive seminar that we had to cancel. We are going to be committed to not only our mindfulness every morning, but on being able to be there for you on the web and offer as many interactive web virtual events as we can. So with that, I'm going to turn it back to Harvey because it is 1 o'clock, and thank everyone for your great questions.
Thank you, everybody. And I'm just frankly impressed on how much we were able to squeeze into an hour. So in summary, I hope you, first of all, recognize that NYAPRS is fully committed to events like this, and there'll be many more of them. And as Edie points out, we're going to try to do a virtual version of our executive seminar. That was a strong program, and we want to keep it alive for people. And just, you know, everything you heard sort of today, I hope really helps you adapt to working at home and gets on the Strive for 5. You know, NYAPRS, we put out emails about that on a regular basis. And my experience is that if you don't work on Strive for 5, Kristen Block will call you up, kick your butt, make sure you do. Right, Kristen? So anyway, yeah, that's a really, that's a huge campaign. And it's one that's going to take a lot of work. And I'll go back to what I said earlier. That should survive the crisis. That should just become what we do, you know, in community to support each other. Recognizing that, you know, a big trend now is loneliness. Sounds self-evident, but it's a whole approach, and books are being written and presentations and to address loneliness as a major issue. So, and I hope you really, again, appreciate the courage and dedication of all these folks around the state. I included the names of the agencies. I wasn't going to do that at first, but I guess you can contact them, look them up online, and maybe they can be helpful to you. And you can email me anytime to connect with them if you like. So thanks again for showing up. I hope you have a safe day. I hope you're well and careful, and I hope you're using your Pharrell as often as you. Thanks. We'll see you again.
Bye, everyone.